You take vitamins to protect your health. But what if you are doing it wrong? What if your daily routine is quietly stressing your body, wasting nutrients, or even increasing your risk of disease? In this video, I will break down 7 common mistakes people make when taking vitamins. They seem harmless, but some can have serious long-term effects. Let's start with one of the most frequent habits. Many people do this every morning without thinking, and they have no idea how much damage it may cause over time. Let's begin with one of the most common mistakes people make without realizing it. It happens every morning. Number 1, you always take your vitamins in the morning. This might be a problem. Let me ask you something. When you take your daily vitamins, do you take them first thing in the morning on an empty stomach? If so, you are not alone. It is one of the most common habits I see in patients who are trying to stay healthy. They wake up, drink a glass of water, take their multivitamin, and move on with their day. It seems efficient. It feels like a good habit. But here is the problem. Taking vitamins, especially multivitamins, on an empty stomach can lead to more harm than help. Your stomach needs a bit of food to properly digest and absorb certain nutrients. Without it, the body struggles to break down the supplement and absorb the vitamins into your bloodstream. What happens instead? In many cases, the pill passes through your digestive system too quickly. You lose a portion of the benefit right there. Worse, some people begin to feel nauseous or even develop stomach pain not long after taking their vitamins. That is because certain vitamins, especially B-complex and vitamin C, are acidic and can irritate the lining of your stomach when there is no food to buffer them. I have had patients tell me they thought they were developing an ulcer, only to realize that all they needed to do was take their supplements after breakfast instead of before. For others, the nausea becomes so unpleasant that they stop taking vitamins altogether, thinking they are the problem. But the real issue is timing. There is another layer to this. Some vitamins are fat-soluble, like vitamin A, D, E, and K. These need dietary fat to be absorbed. If you take them on an empty stomach, or with only black coffee, you are simply not getting the benefit. It is like pouring water into a funnel that is closed at the bottom. So what should you do instead? First, take your vitamins with a small meal that includes some healthy fats. Even something as simple as oatmeal with almond butter or eggs with avocado can make a big difference. If you are in a rush, a small smoothie with yogurt or a handful of nuts will help. Second, if you are someone who drinks coffee immediately after waking up, wait at least 30 minutes before taking your supplements. Caffeine can speed up digestion and interfere with absorption as well. Third, if you are on medications or have a sensitive stomach, speak with your doctor or pharmacist to time your supplements around your prescriptions. Some combinations can cause more irritation than benefit. A simple shift in timing can turn your vitamin routine from irritating and ineffective into something your body can actually use. It is a small change, but one that can have a lasting impact on how you feel every day. Now that we have covered timing, let's look at a nutrient that many people take daily but absorb poorly. Number 2, you take vitamin D every day but still feel tired. This could be why. Vitamin D is one of the most talked about nutrients today. We know it supports the immune system, protects our bones, and even plays a role in mental health. Many people take vitamin D daily, especially those who live in colder climates or work indoors most of the day. But here is something not everyone realizes. Vitamin D is a fat-soluble vitamin. That means your body needs dietary fat to absorb it properly. Without fat present during digestion, a large portion of that vitamin D may pass through your system without being used. I often ask my patients, How do you take your vitamin D? And many of them say, with water, first thing in the morning, no food, no fat, just a glass of water, or maybe coffee. And unfortunately, that habit can quietly rob the body of a nutrient it truly needs. When vitamin D is not absorbed well, the effects are slow and silent. You might feel tired more often. You may notice your bones ache, or that your mood is lower in winter. Blood tests can reveal that your vitamin D levels remain low even after months of daily supplements. What makes this worse is that people often respond by increasing the dose, thinking they are not taking enough. But in many cases, they are taking plenty. They are just not absorbing it. So what is the solution? The answer is simple. Take your vitamin D with a meal that includes some healthy fats. A spoonful of olive oil, a slice of avocado, some nuts, or eggs with yolk. These can all improve absorption dramatically. Even full-fat yogurt or milk can help. If you take a multivitamin that includes vitamin D, apply the same rule. Make sure your body has what it needs to process it. This is a small change in habit, but it can make a significant difference. Vitamin D deficiency affects energy, bone health, immune response, and even heart function. So if you are taking it every day, make sure your body is actually putting it to use. Next, we turn to a vitamin that supports nerves. But in high doses, it can quietly damage them. Number 3. Your fingers tingle for no reason. Check this vitamin in your routine. Vitamin B6 is essential for nerve function, brain health, and energy metabolism. It helps the body process protein, regulate mood, and produce neurotransmitters. Most people get enough through diet, but it is also included in many multivitamins and energy supplements. What many people do not know is that too much vitamin B6, especially over long periods, can actually harm your nerves. It sounds strange. How can a vitamin that supports nerve health end up damaging it? The answer lies in the dosage and duration. High doses of vitamin B6 taken over time can lead to a condition called sensory neuropathy. This affects how your nerves send signals to your brain. It may start as tingling in the hands and feet. Some people feel numbness, burning sensations, or a strange loss of coordination. The symptoms can be subtle at first, but if left unchecked, they can become permanent. The recommended daily intake for vitamin B6 is about 1.3 to 2 milligrams for most adults. But some supplements contain 50, 100, or even 200 milligrams in a single pill. When taken daily, that adds up quickly. People often do not realize how much they are getting, especially if they are using multiple products that all contain B6. I have had patients who took energy boosters for years, not knowing they were slowly damaging their nerves. And by the time symptoms appeared, it was hard to reverse them fully. What should you do? First, check your labels. Add up your daily B6 intake across all your supplements. If it is above 50 milligrams per day, ask your doctor if it is necessary. Second, be cautious with long-term use. B6 is water-soluble, but that does not mean more is better. It still accumulates in tissues and can take time to clear. Finally, if you feel unusual, tingling, numbness, or nerve pain, stop your supplements and get tested. The earlier you catch it, the better the chance of recovery. That brings us to a mistake that affects not just nerves, but your heart and arteries too. Number 4, you take calcium to protect your bones. It might be harming your heart instead. Calcium is essential for bone strength. It is one of the most commonly recommended supplements for older adults, especially women after menopause. But there is something many people do not hear about: the role of vitamin K2. Vitamin K2 is responsible for directing calcium to the right places. It tells your body to send calcium into the bones and teeth, where it belongs. and away from the soft tissues and arteries where it can cause harm. Without enough vitamin K2, calcium can begin to build up in the blood vessels. Over time, this leads to arterial calcification. That makes your arteries stiffer and less flexible, which increases your risk of heart disease and stroke. Many people take calcium and vitamin D together but forget K2 entirely. It is rarely included in multivitamins, and it is not abundant in most Western diets. It is found in fermented foods like natto, aged cheese, and grass-fed butter, but not in the average daily meal. So you may be strengthening your bones while quietly hardening your arteries. That is not the result anyone wants. Here is what I recommend. If you take calcium regularly, talk to your doctor about adding vitamin K2, especially in the MK7 form, which is better absorbed. Look for supplements that combine vitamin D3 and K2 with calcium. That trio works together to protect both your bones and your cardiovascular system. And remember, no supplement works in isolation. Always consider the full picture, not just one nutrient at a time. While some mistakes involve missing nutrients, others come from combining the wrong ones together. Number 5, you're combining these two supplements. They could be canceling each other out. Iron and calcium are both essential minerals. Iron helps transport oxygen through your blood, and calcium supports your bones, muscles, and nerves. But many people do not realize that taking these two minerals together can reduce the absorption of both. When iron and calcium are consumed at the same time, they compete for the same transport pathways in your digestive system. As a result, the body absorbs less of each. This is especially true when both are taken in supplement form, where the doses are concentrated. I have seen this happen in people trying to improve their health. For example, someone might take an iron supplement for anemia and a calcium supplement for bone health, both with breakfast. They think they are doing the right thing, but in reality, their body may be absorbing less than half of what they need. The interaction is strongest when calcium doses are above 300 milligrams, which is not uncommon in typical supplements. Over time, poor iron absorption can lead to fatigue, weakness, pale skin, and dizziness. Poor calcium absorption increases the risk of osteoporosis, even in people who think they are protecting their bones. So what can you do? The answer is all about timing. Take iron and calcium at different times of the day. For example, iron is best absorbed on an empty stomach or with vitamin C, so early morning or mid-afternoon is ideal. Calcium is better with food, so you might take it with lunch or dinner. If you are taking prescription supplements or have specific deficiencies, your doctor or pharmacist can help you schedule your doses properly. And if your multivitamin contains both iron and calcium in high amounts, consider switching to separate products with clearer timing. Small changes like this can dramatically improve how well your body uses what you are giving it. Now, let's look at a vitamin that seems harmless, but too much of it can build up in a dangerous way. Number 6. This popular vitamin might be building up in your liver without you knowing. Vitamin A is crucial for vision, skin health, and immune function. But unlike water-soluble vitamins, vitamin A can build up in the body. And when taken in high doses over time, it can become toxic, especially to your liver and bones. I have seen people take high-dose vitamin A for skin issues, especially from over-the-counter acne products or immune boosters. They mean well, but they do not realize how little the body actually needs. The recommended daily amount is only around 700 to 900 micrograms. Some supplements contain 10 times that, especially when taken with cod liver oil or synthetic forms like retinol palmitate. When your body gets too much vitamin A, it stores it in the liver. Over time, this buildup can lead to liver inflammation, fatigue, nausea, and even long-term damage. In some people, high levels of vitamin A reduce bone density and increase the risk of fractures. The opposite of what they hoped to achieve. The scary part is that these effects build slowly. You may not feel anything wrong until real damage has already occurred. So what should you do? First, avoid megadoses unless specifically prescribed if you are taking a multivitamin. Check the label to ensure vitamin A comes mostly from beta-carotene, which is safer and converts to active vitamin A only as needed. Second, do not combine multiple products that contain vitamin A. Cod liver oil, skin supplements, and vision formulas can easily add up. And third, if you're experiencing symptoms like headaches, nausea, or unusual fatigue, and you take high-dose vitamin A regularly, speak to your doctor. A simple blood test can show if your levels are too high. With vitamins, more is not always better. And with vitamin A, too much can silently do harm for years before anyone notices. And third, if you are experiencing symptoms like headaches, nausea, or unusual fatigue, and you take high-dose vitamin A regularly, speak to your doctor. Simple blood tests can show if your levels are too high. With vitamins, more is not always better. And with vitamin A, too much can silently do harm for years before anyone notices. Finally, we reach a vitamin that many people overdose without meaning to, especially when trying to boost their immunity. Number 7, trying to boost immunity with vitamin C. Your kidneys might pay the price. Vitamin C is often seen as harmless. It boosts the immune system, helps with collagen production, and acts as an antioxidant. Because it is water-soluble, people assume any excess just gets flushed out. But, like most things, too much of a good thing can backfire. And in this case, it can affect your kidneys. When vitamin C breaks down in the body, one of the byproducts is oxalate. Oxalate is a natural compound that can combine with calcium to form kidney stones. For most people, this is not a problem in small amounts. But when you take large doses of vitamin C every day, especially in the form of supplements, the amount of oxalate increases. This raises your risk of developing kidney stones. Sharp, painful, and difficult to pass. I have met patients who were shocked to learn their daily vitamin C habit was likely contributing to their kidney issues. Some were taking 1,000 to 2,000 milligrams per day, thinking it was boosting their immunity. In reality, the recommended daily amount is around 75 to 90 milligrams. Even during illness, short-term use of higher doses should be approached with care. What should you do? First, if you are healthy and not dealing with a deficiency, you may not need a supplement at all. You can get enough vitamin C from food. Citrus fruits, bell peppers, strawberries, and broccoli are all rich sources. Second, if you do take a supplement, try to stay within the recommended daily limit unless your doctor suggests otherwise. Third, if you have a history of kidney stones or kidney problems, talk to your physician before using vitamin C supplements long-term. It is easy to assume more is better, especially with something as familiar as vitamin C, but your kidneys might feel differently. Let me leave you with a few thoughts that may change the way you take vitamins from now on. So now you know 7 mistakes that seem small, even harmless. But when repeated daily, they can quietly work against your health instead of supporting it. The truth is, vitamins can be powerful tools, but only when they are used correctly. When you get the timing right, the combinations right, and the dosage right, you give your body what it actually needs, not just what you think it needs. I hope this video has helped you understand your daily routine a little better. and maybe even inspired you to take a second look at your supplement shelf. 2. If you found any part of this helpful, please like this video and subscribe to the channel. It helps more people discover information that could truly improve their health. And before you go, leave a comment and let me know where in the world you are watching from. Your story matters, and I would love to hear from you. Take care of your body. It is always listening, and it always remembers how you treat it. See you soon in the next video. Have a good day.